So let me start off with this question first. And I know there's so many of you that I can't see everybody's faces. But if you can just put a thumbs up, use your reaction button or your own hand. Now, who in this room has never had any joint pain or muscle aches in their whole lives? Okay, it looks as if nobody's putting up their hands. And you know, for once, this is not a bad thing. It's just an indication of how common this problem is. As Gabby said, we all have joints. We have many of them. We have many muscles that link out our joints together, many ligaments that hold our joints together. And we use them all the time. We may not realize it, but even, you know, when you're talking, there are little tiny joints in your voice box that are moving so that your voice changes. So we're using our joints all the time, and it's natural that aches and pains are part of our lives. Some of them are not necessarily bad things. Sometimes you have good aches and pains, like after you have done. So my children are now into this HIIT sequence they found on YouTube, and then they asked me to do it with them. And at the end of the day, I have these aches, very, very bad aches sometimes. But those are good aches because I know that I'm building muscle from this whole experience of exercising. But there are, of course, aches and pains that aren't that warn us that something is wrong, and those are the ones that we are going to concentrate on today. So like I said, you are not alone. Joint and muscle pain is one of the most common types of chronic pain. And if you ask any GP or an emergency department, and this is all across the world, it is one of the most common complaints that people come in with to get checked out. And it is also one of the common causes of disability worldwide. So what will I be talking about today? I will be going through some of the common causes of joint pain. I want to cover a small section of when we need to actually be worried and when you should see a doctor. And then the part that I really want to focus on are what are the things that we can do to help ourselves on a day-to-day basis. So when you go to your doctor and you say, oh, I have joint pain, or I have knee pain, or ankle pain, or back pain, there's actually a lot of many conditions that then would pass through my mind to think about, okay, so is this from something that's really simple? When I say simple, I mean that of course it's painful and it's not a nice thing to be experiencing, but it's not difficult for us to solve, like sprains, or is it something that's caused by overuse, strain injuries, or just the way that we hold ourselves and our posture? Is it something that isn't dangerous, but that is a chronic disease and we have to deal with it? So something like lack of vitamin D, is it degeneration or wear and tear, or what we call osteoarthritis, or is it something like gout? And then of course they're the ones that get us really worried. But these are very uncommon. Okay, so fractures, I think, are the less uncommon, but those tend to come with some form of injury. The uncommon ones would be the things that we see in the rheumatology department. So immune disorders like rheumatoid arthritis. So out of like maybe 10 people who get referred to us, maybe 1 or 2, and these are already people who have been screened by their GP, actually do have an immune disorder. Most people fall into the first or the second category. And then of course, I put cancer there, not because it's a common cause of bone pain, but because all my patients, most of my patients have this fear, and I thought we'll talk about it. Especially if you have really bad back pain or something, they're like wondering, am I dealing with a cancer with bone involvement? That's why I have pain all the time. So let's start with sprains, strains, and overuse. And I think all of us at some point in time have done this. We might have been a bit too quick to walk down the stairs, or not watching where we're going and we trip, we twist our ankle, or you might have done something that carried something that's too heavy and sprain your wrist. So this is something that's really common. So what happens in these sorts of injuries? they occur when there's a lot of stress over either the bone, the tendon, the muscle, the ligament. So it's a whole system together over every joint. And this could occur as a single event, meaning like what I said, you tripped and you fell and your ankle really twisted in a very awkward position that would cause a sprain. Or it could be you carried something really heavy that you're not used to carrying, and then you strained your shoulder, right? Or it could happen because of repetitive stress. And this can be either repetitive high weight sort of stress over a normal joint or tendon. That could be part of your occupation or part of either your hobby. So for example, one things I put down there is runner's knee, which is inflammation of one of the tendons around the kneecap. And you can have a normal knee, but if you keep running and running and running, that could happen. Or it could happen because you're doing something that's fairly light, but your tendons and your muscles are very weak. And so they cannot stand up to that strain that maybe in the past or before the injury might have been okay. So a common example of that would be, I see this a lot in my older patients who have carried something heavy and then injured the tendons in their shoulder, and that can be really painful and can take quite a long time to get better. So I put a couple of common sort of injuries that we see. Rotator cuff tendonitis, like I said, is from the shoulder. We have 4 big tendons that wrap around the shoulder that allow our shoulders to move. And any one of them being injured can cause you to have pain and inability to do things like put your arm up straight or put your hand behind your back. So people say, no, I can't take off my t-shirt easily because I can't do this with my elbow to take it off, or it's really hard for me to wash my back because I can't scrub the middle part anymore. I can't get there. Rotator cuff tendonitis. Tennis elbow happens if you lift things a lot, the heavy things with your elbow as the fulcrum, and then you get pain over the outside of your elbow. And it's one of the tendons that goes into this part and does this. So let's say people who have tennis elbow would find it really difficult to lift a heavy kettle because that's the tendon that you are using. Dequevans is also known as mum's thumb. It's when this particular tendon here gets painful and inflamed. This happens when you do things that use your wrist a lot, like for example, wringing cloths. And it's called mum's thumb because for new moms who have babies, and the way they carry the baby, sometimes you're not used to the weight and you don't carry them properly, then it strains this part of your the tendon. So I must say I have had to do injections for quite a number of my colleagues who were new mothers who had this tendon problem. Trigger fingers are also really common. They're when you overuse by gripping too much, and then your finger gets stuck and cannot open in the morning. And I mentioned runner's knee just now, which is a patella sort of tendon problem. And then the other really common ones are heel pain. So people who have Achilles tendonitis or plantar fasciitis tend to get pain in the morning when they wake up. They first step on the heel and that's really sore. And then as they start walking, it kind of gets better. And it's usually due to poor footwear or overuse of the ankle. So these are really, really common. And the difficulty for many people is that they happen with day-to-day activities, and we need to find out what's this activity that kind of triggers this so that it doesn't keep coming back. And I put this picture because when I talk about rotator cuff tendonitis, this is one of the common things. I think we all know exactly how heavy it is to put a bamboo pole outside of the window. Even worse if you're washing towels, bed sheets, and then that sort of things. And for an older person whose shoulder muscles are not very strong anymore, when they put that out of the window with that heavy weight, all the tension is going into the tendons, and that can really tear the tendons quite easily. So day-to-day things, and you may not think about it as an unusual activity because you do laundry all the time, but that could be something that might make things worse. So, Chinese name of rotator cuff tendonitis. I'm afraid I do not know. I will have to check it up and get back to you, because I don't know what rotator cuff is called in Chinese mainly. So the next part is posture. So this is my little girl who wants to be a ballerina. And we don't think about posture a lot when we are young because it doesn't cause us to have a lot of problems. But as you get older, it becomes more and more important. And I think I cannot not talk about this, especially in this day and age where all of us are now peering at our computer screens. And you're peering at me through the computer screen and I'm peering at you. We call this tech neck. And it's pain over the neck as well as in between the shoulder blades that comes from looking down, either at a smartphone, because a lot of people walk around and they text or they're texting at their desks, or working at a computer in a not very ergonomic way, because most of the time our screens, especially if you're using a laptop, is lower than your head actually is. And that causes a lot of strain at the neck. And it doesn't just cause neck and shoulder pain, it can later on give you headaches as well. So sometimes it radiates up to the head and you feel almost as if you're having a migraine, the eye gets painful as well. It's all from the muscles of our neck. So I think it's a real thing. There are days where I have a very bad habit. I don't have very good posture when I am on Zoom. And I tend to like to lean forward and look at people when I talk to them, so I feel closer to them, and then that makes my head go even more forward, and I can end days like a full day of Zoom. I know that I ended with a headache. So I talked about our head moving forward, and why is this important? It's because our head's not actually very light. Our head's quite heavy. It's got our skull and our brain inside, and normally it's, say, about 5 kg. Maybe some people are really smart; their brains are heavier. But every time you move your head forward, and the lower you get, the force of gravity then causes the effective weight on the back of your neck to get greater and greater, because your neck, the muscles back neck have to strain to then hold your head in that position. So by the time if you really, really look down, then your head becomes 27 kg. So can you imagine your poor neck, which is a very, very small area compared to, let's say, our thighs and everything, holding up 3 big bags of rice. And no wonder you get pain at the end of the day, right? The posture doesn't just affect your neck, it also affects our lower back. So the pressure on the discs, which are sort of the cushions in between the bones in our spine, get greater and greater as you slouch forward. So ideally, many of the sort of like pieces of advice about how to sit when you're looking at a computer actually says you should sit backwards a little bit. You should recline slightly. That gives your back the least pressure. I personally find that a little bit difficult, because then I feel as if I look as if I'm not paying attention if I talk to you like that, and leaning back and all that is a bit weird. So but I think the minimum you should be doing is sitting upright. The other thing about posture that I'm moving away from the neck and the back down to our feet, and this I think is a bit more specific to ladies, is about the sort of footwear that you wear. And I'm guilty of this as well. So I tend to wear heels, but they then put your entire back and your pelvis in a very weird position. And that gives you a lot of strain, both at your lower back as well as your neck and your knees, and also the toes, because when you're on heels, then all your body weight gets scrunched up onto that little few toes that's holding everything up. So moving away from strains and sprains, and I'll talk about how we manage each of this at the end when we talk about self-management. I want to move into the other things which are more like disorders that can be corrected. And sorry, I'm just keeping whether there was a question in the chat that I should answer before I go on. Oh, somebody has done the Chinese translation. Thank you so much. I have to admit that I cannot read it. My Chinese is very, very poor. So when I say vitamin D deficiency, some people will say, you can't be serious. We live at the equator. We're a tropical country. It's sunny all the time, even when it's raining. How can we be vitamin deficient? We're not living in Scotland or something like that. But the irony is that even though there's lots of sunshine here, many Singaporeans do not get the sunshine. In part because we spend a lot of time indoors. And when we do go outdoors, then everybody's like holding their umbrellas and walking in the sun, or because of our skin tone. So the darker skin tone you are, the harder it is, or the more sunlight you need to then convert the sunlight into adequate vitamin D. So in some of the community studies they've done, even for very young, active adults who are under 30 in Singapore, about half are actually vitamin D deficient. And as you get to the older adults who spend less time in the sun, it goes up to about 70%. And vitamin D is important because you need it for muscle and bone health. Both your muscles tend to get weaker without vitamin D. You can get aches, especially along the big areas where big muscles go into the bone. And if you're vitamin D deficient, you're more prone to things like osteoporosis, which then can lead to fractures. So something to take note of, I must say, I checked my own vitamin D a couple of years ago, and it was shockingly low. Even though I thought I do spend some time in the sun, but of course I go out to the sun with sunblock and all sorts of things because, okay, I think many women will understand it when I say that hyperpigmentation or freckles is something that we would like to avoid, and hence there's a balance. Of course, the dermatologist will say don't go out to the sun at midday because then you increase your risk of skin cancer. So this might be something that you may not be able to, you may not want to correct with natural sort of sunlight, but with supplements and vitamins instead. So osteoarthritis is really common. Again, although we often say this is wear and tear and it's part of aging, actually it's a different experience for everyone. So some people are more prone to osteoarthritis, some people are not as prone to. It can start as early as, I have patients with osteoarthritis in their 30s or early 40s. But of course, by the time you get into your 70s or 80s, then a majority of people will be suffering from osteoarthritis. It affects about 10 to 15% of the population worldwide. So one of the most common causes of arthritis, so to speak. And the common joints that we would see osteoarthritis in would be the spine. Then in Singapore, we see it in the knees more than the hips, and also the hands. So what are some of the signs of, or rather, what will you feel if you were having osteoarthritis? Well, you may have painful joints, and the pain is a pain that gets worse when you use it and better when you rest, because of the nature of the wear and tear, where the bones are kind of rubbing against each other. And it also comes with this thing that we call gelling, which means that if you sit down for some time and then you get up, you feel that your joints are really stiff and you can't move easily. You need a couple of seconds or sometimes even a few minutes before the movement feels natural. So this can cause quite a fair bit of anxiety. Some of my patients, may say if they're on the MRT or they're on the bus and it's their stop and they need to get off, they need to actually start standing up one stop or so before they need to get off, because they can't just get up and walk. It's too stiff for them to rush. The joints may also appear to be larger. So for example, osteoarthritis of the hands, many people would say like, I can't wear my wedding ring anymore or rings because they just can't get over the knuckle. And that's true, is because the bone has actually expanded, or your hands or knees might appear more knobbly. And as spurs form, the range of movement that you get will also be limited. Osteoarthritis is interesting because it's actually caused by the wear and tear of our cartilage, but somehow our body cannot make new cartilage, and instead it sends a signal to make new bone, and that's where you get the bone spurs from instead of new cartilage, and that causes us to have more problems. So osteoarthritis, who is at risk? Of course, like I said, people who are older, people who are overweight, people who are using their joints a lot or have previous injuries that cause the joint to be unstable already, or for the balance to be off, and people who have a family history of osteoarthritis. You might notice that if your grandmother and your mother had knobbly fingers, and then yours might start to turn knobbly sooner, or had turned knobbly a bit earlier than theirs did as well. And of course, being born with joint deformities also make the joints wear out a lot more quickly. So moving on to another very common cause of arthritis, which is gout. So which appeared in the newspaper today, actually. I think they had an article about does drinking bubble tea every day cause gout, which is something I'm going to talk about as well. Now, gout tends to affect men more than women. And that's because estrogen actually helps to regulate our uric acid levels. Uric acid is the crystal that causes gout. So, but for women, that protection only lasts until menopause. And after menopause, because of the lower levels of estrogen, you're not as protected as before. And so older women also do get gout. Gout causes very, very acute attacks of joint pain that can be extremely severe. Within hours, the joint can become red, hot, swollen, and you cannot use that joint anymore. So I think a very common experience that many patients with gout have is that they may either wake up first thing in the morning and realize that their ankle is red, hot, and swollen and they can't step on it. Or they could say in the morning it felt a bit painful, and by lunch it was so bad that they were hobbling and they had to go home from work or something like that. The pain is much more severe than you would see in another form of arthritis, let's say osteoarthritis or so, and much more sudden. It comes on very, very quickly. But after a couple of days, even if you don't do anything and don't take medication, it will go away on its own. And in between the gout attacks, the patient is perfectly well. So this is a misconception many people have, because they may have persistent joint pain in their hands or in their feet, and then they think it's gout because gout's a very common cause of joint pain. But the pain in gout comes and it goes, and you're well in between. It's not something that's there every day. Gout is important to treat because if the levels of uric acid in your blood remain very high, then these crystals start to come out of the blood and they can deposit in the skin, in the kidneys, in the joints, and they can cause very bad deformities. They can cause kidney failure. And recent studies have also shown that if your uric acid levels are high, you have a higher chance of dying from a heart attack or a stroke versus someone who does not have high uric acid. So even without the attacks of gout, that is something that we would want to make sure that our own uric acid levels are not excessively high. Now I'm going to move to the uncommon causes, and I wanted to just re-emphasize that this last component are things that are really not common, and because they are of course much more worrying. So fractures. Usually fractures will be associated with some form of injury, but if you have osteoporosis, your bones are very fragile, you may actually get fractures without remembering the injury. So it could be something as simple as sitting down heavily. So I have patients who have very severe osteoporosis, and all they did was they sat on a chair quite heavily and they fractured their spine. Or it could be coughing very vigorously and then they fracture a rib. Or one of my patients was putting on her skirt and then she stepped on her other leg. Her foot as she was putting on her skirt because she kind of was a bit unbalanced, and then she fractured her foot that way. So very, very small sort of things which you may not consider an injury versus, let's say, the falling down a flight of stairs or a bicycle accident where it's very obvious to us that there's an injury. The common ones would probably be falls. For fingers and toes, it'd be if you drop something on it or you stubbed it against a piece of furniture or a door, something like that. The bone or the joint would probably look very bruised and maybe swollen. In the beginning, especially if it's just a little toe or finger, it can be hard to tell whether you've just sprained it or if it's a fracture. But for a fracture, the pain will not get better and will be very painful to use. Sometimes you can hear creaking noises as you try to move it because of the bones rubbing against each other. And if the joint is deformed, meaning if it's twisted in a different direction, then for sure it's a fracture, and you must come to the hospital straight away. Another misconception that people have is that if you can walk on it, then it's not fractured, or you can use the joint, it's not fractured. It depends on the type of fracture. So like for my father fractured his hip about 2 years ago now, and all he did was we were getting out of the car and he had helped my daughter come out of the car, and then he lost his balance and he kind of tried to rebalance himself by hopping to not fall down, but I think that created a greater momentum, so he fell and landed on one side. And after that he got up and he walked into the house. But then the pain got worse and worse, and when we brought him to the hospital, he had really fractured his hip. So just because you can walk on the joint or you can use the joint does not necessarily mean that it's not fractured. So there are many types of immune arthritis, but I'm only going to describe rheumatoid arthritis because this is the more common sort of immune arthritis. It tends to affect young women, women more than men. When I say young, I mean somewhere around the 30s to the 40s, sometimes the 50s. That's usually the age that patients start having rheumatoid arthritis. The pain starts slowly, builds up over a few weeks, and is persistent. It stays there all the time, and the joint can be warm and swollen. Patients with rheumatoid arthritis, unlike someone with, let's say, osteoarthritis, where only after you use the joints then it's painful, the pain is worse in the mornings when they wake up and the joints are very, very stiff. The patient will say, I need to warm up, and it takes them hours, sometimes until after lunch, before they can start forming a full fist with their hands, for example. And it's not just a disease of the joints, it affects many parts of your body as well. So the patient may have fever, may be very tired, they may have lost weight, or have rashes. It's important for us to identify this early and treat it, because if we don't, then the joints can get very deformed because the inflammation eats away at the joints. Fortunately, if you see that picture on the bottom right, we don't see these sorts of deformities nowadays because most of our patients are referred very early to us and they start on good treatment, so you cannot tell that they have got rheumatoid arthritis. I put a picture of one of my patients so that you would kind of know what it looks like if you have an inflamed joint. So over here, this patient has an inflamed joint on her middle finger. The difference between, so some of us have really knobbly hands, and it's hard to tell whether they're swollen or not. I was just joking with a patient yesterday. I was doing an ultrasound scan for her. My family has quite a strong history of hand osteoarthritis. And I said, when I first started doing ultrasound scans, which is now about 12 or 13 years ago, I could show the patient my fingers and say, this is normal and yours is not normal because you've got bone spurs. And now I can't do that anymore because when I scan my fingers, I have bone spurs too. So that's really quite normal for many of us to have a little bit more knobbly fingers and a bit bigger than we would remember them to be. But this patient, you can see this middle finger, the skin has changed color. It's actually darker. That's because, and you can see that it's swollen, and the creases over her skin is not obvious anymore, not so obvious as the second and the fourth finger. And that's because it's inflamed. And if I were to press it, I would be able to feel that it's puffy, and she would feel that it's very tender, and the joint over that part will be warmer. So if you ever have this situation, this is one of those red flags that you must come and see a doctor. Okay, which brings me nicely to my next point, which is, when do you contact your doctor for joint pain? So these are the important things that if you are having this, you should seek medical attention fairly quickly. If the joint is swollen, hot, and red, and let me put a little caveat here, and you are not someone who knows you have gout, because patients with gout generally know how to manage their own gout. They get attacked, the joint is swollen, hot, and red, but they know what medication to take. But if this is the first time that's happening, your joint is swollen, hot, and red, you should see a doctor quickly, because this might actually be an infection in your joint. If the joint pain is associated with fever, or if the pain is so severe that it wakes you up at night, and this is the particular symptom that we worry about, which makes us worry about someone who has cancer with bone spread, because the pain is intractable. The patients will not be able to find comfort or relief from anything aside from strong medications, and it keeps them awake, and I will wake them up in the middle of the night because it's so painful. If the pain is affecting your mobility significantly, you should see a doctor. And if you have weakness or numbness of the limb that is involved, then you should also see a doctor quickly, because then it might mean that your nerve is being pinched, or the pain is coming from a nerve rather than the joint. If you have back pain and you cannot control your bladder or bowels, that is something that needs urgent attention, because it might mean that something is pressing on your spinal cord, and you can't, and then that makes you lose continence. If you're losing weight and have no appetite, if the joint pain is not going away with your self-management, and it's also if it's not the only symptom that you have. So if you have joint pain with rashes, or with diarrhea, or joint pain with breathlessness, or something like that, it's a combination of things, then you should go and see a doctor early. And of course, if you have suffered an injury before the pain started, because then we are concerned about whether this could be a fracture. So if you do go and see a doctor, or if you do bring your relative or someone that you're caring for to see a doctor, how will they tell that you have arthritis? A lot of it depends on the story that you tell them, and the doctor will be very careful about this. When did it start? Which joints did it involve? What makes it better or worse? What were the things that you've tried, etc. So it's important that you prepare this before you go and see the doctor, because sometimes when the question gets asked, you're like, oh my goodness, I don't even know when it started. Then my patient will be like, I think it's 3 months. Then I'll be like, okay, so meaning at Chinese New Year, you didn't have pain? And they're like, no, actually I had pain in Chinese New Year. Then I'll be like, okay, so do you have pain at Christmas? And they're like, oh yeah, I had pain at Christmas. And it becomes a little guessing game for us of how long this has been going on for. If you have pictures to show of swollen joints or the bruises, etc., even better. Get them ready, put them in a special album so that you don't need to go through all your WhatsApps and everything to find it to show to your doctor when you see them. You will be examined for joint pain and tenderness, of course, and most of the time you will need to have, unless it's a sprain or overuse, you will probably need to have blood tests and x-rays done for us to make a full diagnosis. So I'm going to move on to my last part, which is what are some of the things I can do to help myself. And this, of course, refers to the first two categories of causes of joint pain, and not the last one, which definitely will require medical intervention. And I put this slide here because I get asked this all the time. Do I get arthritis because the weather is rainy, or because I use a lot of water, I wash my hands, I do a lot of dishwashing or laundry, or because I used to drink cold water, and that's why I get all these aches and pains. And the scientific answer for this is no. Joint arthritis and is not caused by this. But I must say that every patient has a different experience. So I do have patients who say, I can tell when it's going to rain. My joints will tell me. And that's the patient experience, and I believe them that that's the case, but it's not caused by the weather, for example. So let's start with lifestyle changes. And I've taken all this off the Health Hub website, which really has amazing resources. If you've never gone to Kepo what's inside there. So lifestyle changes includes getting adequate exercise. And the definition of adequate exercise is 150 minutes of moderate to vigorous exercise per week, which is actually it's not that little if you think about it. Fortunately, many things that we do on a day-to-day basis get counted as moderate exercise. So if you mop the floor, it counts as moderate exercise. But I guess depends on how big your house is. You may not mop long enough for you to clock the number of minutes. The other, of course, would be to maintain a healthy weight. The problem with osteoarthritis, like I mentioned, is not just the weight that weighs it down, but that the higher your BMI is, it actually causes greater amounts of inflammation in our body. And that's something that's fairly recent in the literature. It's really very interesting. And because we are Asian population, our healthy BMI is not 25 and under, it's actually 23 and under. So do know what your BMI is. So like I was just saying this, osteoarthritis, we used to tell people in the past, like if you lose weight, then your knee osteoarthritis gets better because of your offloading weight on your knees and your hips. But then it's been found that people who are overweight get osteoarthritis of their hands as well. And they clearly don't walk on their hands, and yet the hands, the bones in the hands wear out faster. And so that's because of the chemicals that are produced within these white adipose tissue, the fat cells that drives inflammation and actually speeds up cartilage breakdown. So when we talk about maintaining a healthy weight, we also need to know how much calories that we need. Again, this is from Health Hub. They've got a nice calorie counter. We may be surprised, I remember when I was in school, and this was medical school, the teaching was that, a man needs 2,000 calories, a woman needs about 1,800 calories. But we realized that's really overestimation of the amount of calories we need. It really should depend on your age, your how sedentary or how active you are, etc. And so, like for myself, when I did this a couple of years ago, I was actually quite surprised that my calorie intake was actually less than 1,500, which sounds very little. When you think about it, usually I thought I had 1,800, but actually I needed less than 1,500 on a daily basis. So if I want to lose weight, I have to eat even less than that to lose weight. And also not just knowing how many calories you need, but also if you necessary, then count calories. And there are many apps that help to do this. Of course, the Health Hub app does it. Things like MyFitnessPal has all our hawker food and our local food inside. So it's easy to see what you're eating. And of course, our healthy plate now is not like in the past where it was half a plate of carbs and then meat and vegetable, but it's actually half of vegetables and much less of carbs. Yeah. Counting calories is really quite interesting. I always, like after clinic, sometimes I'm a bit hungry, then I want to get a snack, and then I get a bao, and I think a bao is not a lot of calories. Then I realize a bao is almost 300 calories. That's like a meal already. So my little snack actually was much more than I needed for the day. And of course, skip the sugar. So this was what was being talked about in the article today on I think it was CNA about how sugar can cause a lot of detrimental effects. Sugar causes not just it's not just for people who are diabetic. It doesn't just cause your blood sugar to rise. Having lots of sugar, especially in fructose, even causes your uric acid to rise. So if you do have gout and you're really controlling things like red meat, but you're taking lots and lots of fructose based beverages, your uric acid can still be very high. So our daily requirements are somewhere between like 20 something, and you can just imagine if you just have a cup of bubble tea, which seem to be very, very popular around any time that we have circuit breaker or things like that, then you totally busted your sugar allowance for the day or for the 2 or 3 days really. One of my colleagues put this together for those of you who are 3-in-1 fans. 3-in-1 is very, very bad. I think at the end of this, the conclusion is just drink water lah. That's the best thing to drink. Or you need then drink kopi o kosong and teh o kosong. So you can see some of the calories, like super white coffee is 175 calories. That's about half of what your lunch should be already. So for people who have gout, there's a different diet intervention. And of all the arthritis, gout is the main one that you have a lot of control over in terms of your diet. So high purine foods, purine is a protein that gets broken down into uric acid in our bodies, should be avoided in patients who have gout. And the foods that have really high purines would be things like red meat, innards, so don't go and eat kway chap and all that sort of nice things, seafood, and also alcohol, especially beer. Of all the alcohols, beer is the worst. Recent studies have shown that even if you have a high purine vegetable, which are things like soya beans, for example, it doesn't cause the uric acid to go up, which is kind of different from what we always thought, because a lot of my patients, they cannot eat豆类stuff because then they will get gout attacks. And I remember when this study came out, Mr. Bean printed the newspaper article and stuck it on their counter in Seng Hospital. But like I said, the patient experience is different. So I do have patients who drink soya milk and then they get gout attacks. So for them, I'll say just avoid it. But there are patients who can take it with no problems at all. So alcohol should be avoided because it doesn't just build your purine, it then doesn't allow you to get rid of it in your, we normally pee out all the extra uric acid. And then, like I said, the other thing would be to limit fructose because the sugared beverages, these are fruit juices. Eating fruits is okay, but drinking fruit juices is really not very good. Or any of the sweetened beverages, these are not the zero salt, these are the full sugar beverages, or the tapioca pearls and bubble tea, very, very high in fructose. And that would increase the uric acid as well. So another part of self-management is sorry, I was just looking at the chat. So Joyce was saying that can the normal housework replace a walking exercise? And it depends on your level of activity of housework. But yes, you can add it up. So, but it shouldn't be housework 150 minutes the whole week. You should be having some exercise, and some parts of it is housework as well. Yeah. And so getting enough restful sleep is very important. I think all of us have experienced this. If you're very tired, let's say you sleep, your sleep was very fragmented, you kept waking up, or you had very few hours of sleep, you actually feel quite lousy the next day, right? It's not just that you're tired, your body tends to ache as well. And it's because pain signals are actually amplified by the brain when sleep is not adequate. And it's a very, very common observation that we have, that people's aches and pains, even whether it is a muscle sore ache and pain, or whether it's because you have an immune disease, actually gets a lot worse when you're stressed. And this stress could be emotional stress, or as well as physical stress, and lack of rest. And also recent studies have shown that if you don't sleep enough, you tend to put on weight more easily as well. So if you do have a sprain or an injury, what can you do for yourself? And if you go to a doctor, this will be the same things that we would tell you as well. We call it the price management. So P is protect. Don't do whatever you were doing before that caused this injury or cause. Rest that limb. If it's if it's your leg and you need to walk, you might need to offload the weight on a crutch or a walking stick. I sit. This is in the acute part of your injury. You can use a cold pack, or you could just put ice or some frozen peas or something like that in a plastic bag, and then wrap it up in a towel and then put it on top of the joint or the muscle for about 15 to 20 minutes. Don't put the ice directly on your skin, because the ice you can get cold burns on your skin if you do that. And then you can use a compress if you don't have a sort of special bandage. Just wrapping it up and keeping it tight helps as well. And then of course the last is elevate the area. So you put it up on if it's your arm, put it on pillow, or if it's your ankle, then prop it up on a cushion as you're sitting down. That will help in the initial management. For people who are prone to injuries, especially of the hands, these specific hands, avoid the activities that cause strain. So if you're doing something that's using a lot of force on the small joints of your hands, and you already have wear and tear in your hands, that makes a wear and tear progress faster. It makes all the muscles there and the tendons and the ligaments work a lot harder. So things like wringing, cloths to dry, and many of my patients, when they mop the floor, it's not enough to twist the mop in the pail. They must use their hands to wring the mop dry so that the floor isn't too wet, or opening very, very tight cans. These are things that actually can really hurt your joints. So I mean, for us, pre-Chinese New Year is a major flare time for many of my patients, because there's all that housework, that the spring cleaning that has to be done, and then there's the baking and the cooking and all the things that use lots and lots of joints during that period of time. You also want to ensure that your footwear supports your feet. So in Singapore, slippers are favorite among everyone, but they actually are very poor footwear, because it doesn't support the arch of your foot. And so when you walk, your ankle keeps turning in, and you're actually more prone to injury after that. And as Asians, most of us are a little bit flexible, which means that your ankle can wobble as if you're not walking in good shoes, especially for girls. So females, young females, their ankles can be really quite unstable in slippers. Make sure that your shoe has an arch support. It has a heel support, meaning the back also should have a support. And of course, the toe box should be comfortable. So this is another, building strength and flexibility, of course, is another thing that's really within our own control. HPB Health Hub has lots of nice videos to follow. Tan Tock Seng website also has a couple. Our physio department put it together. This one was a 7-minute, 7 sit-down exercises for older people, for just beginning to do exercises. These were specific exercises for tech neck, or people who have a lot of neck strain. So I only listed 4 because I think these are very easy to do at your desk. You don't need to change into exercise clothes or something like that to get these done. So they include shoulder shrugs. So you just put your shoulders up and down. Neck tilt, where you will tilt your head to one side, and you will feel this sort of like stretch over this part of your neck. And then chin to shoulder stretches the back of your neck. So what I tell my patients to do is, you do one where your head tilts, but you're looking straight. Do one where you're looking as if you're looking away to your right, and then tilt your head that way as well. And you will feel that the ligaments that you're stretching are actually on the more behind part of your neck rather than the side of your neck, which is what you're stretching when you do a neck tilt. And actually these are the ones that get really, really tight if you're looking in the computer all the time. And importantly, you also want to open, you would do opening your chest and your shoulders. So you would clasp your hands behind your back, and then just kind of like push down like that girl in the picture over there, making sure that your pec muscles are being stretched out and your shoulders go back as well. Because our tendency as we do a lot of computer work or device use is that the shoulders come forward, and then these muscles here get very, very tight. And then that is a whole system, right? So then everything gets very painful. So this needs to open as well. Of course, if you have a door handy, doorway rather, not the door itself, you can always put your shoulder against the door frame. and then lean forward, and that pushes your shoulder, keeps your shoulder back as your body leans forward. That helps to open up your chest and shoulders as well. Doing this really makes you feel, it really does make a difference. So for osteoarthritis, you want to work on both flexibility strengthening as well as aerobic exercises. And I just put together a couple of pictures of very simple stretches. These are some calf stretches that people can do with either just a chair to balance, and this one with maybe with a towel to pull your legs straight, as well as quads strengthening exercises. Of course, these are specific for knee osteoarthritis. For knee osteoarthritis, we want to make sure that we prevent the knees from the degeneration of knees from progressing, so that you avoid having to go for a knee replacement surgery until as late as possible, or hopefully never. And a lot of people who have knee wear and tear also have very weak muscles around the knee, because the knee is painful. You're trying to not to use it. And when the muscles are weak, then the two bones grind against each other even more. Whereas if your muscle was strong, then your muscles would be pulling the two bones apart, and then they don't grind so much. And you can protect your knee for much longer. So I teach my patients this very simple exercise that they do sitting down on a chair, lifting your thigh off the chair, and then kind of half straightening your knee. And just doing that with a amount of like in sets of 10, building up from 10 repetitions each knee to 20 to 30 to 40. Actually, you can see within about 1 or 2 weeks the difference in the pain of climbing downstairs, for example. The other exercise that I like to teach my patients is a supported half squat. And recently, one of my, I think was just like, she must be 89 this year, really lovely patient of mine came, and she was so proud because she's been doing this with her daughter, and she wanted to show me how she could go all the way down and then come up unaided, and it was such an achievement for her. And I thought that's really good, because this is not that easy. Even when I do squats, I feel the strain. So for someone who's almost 90 to be able to do that, it's really excellent. But for older people, do it with a chair, because you want to prevent falls, of course. Or if you don't have a chair, then we can use the window grills so that you hold something as you go down and come up. And of course, for people who are on smartphones and have Fitbits and everything, make your smartphone do more for you. Track your steps, because you're trying to get up to like somewhere near 10,000 steps a day. Track your calories, track your weight, etc., and things like that. So just to wrap up, to talk about pain relief, it's not just about pills. So using a hot or cold pack or warm bath, or even sometimes if your muscle's very tight, the gentle stretching and massage really helps. Just a note about when to use hot versus cold packs, because I think sometimes this gets a bit confusing. So I said just now, you use an ice pack if you've had an injury, or if your joint is hot and warm, that will be the time to use an ice pack. If you have a really tight, let's say really, really tight shoulder, and you know there's a muscle sort of like it's spasm, then use a warm pack instead. The warm pack will loosen the muscles, and then make it easier for you to stretch as well. Pain medication, you can take over-the-counter medication like Panadol, or something a bit stronger like Brufen. Just make sure you're not allergic to it. If it's a joint that's very superficial, like your wrist, or even the ankles, actually the patches or the gels form work as well as taking a tablet. So people who don't like taking medicine or get a bit of sensitive tummy can use the patches instead. So these are, I call them GOUT, but you can buy them at Watson's or Guardian. By Panadol, they actually have, or like Angmo GOUT, because there's actually pain medicine inside that plaster that you stick over the area that's painful. The sort of GOUT you will buy at the Chinese medical hall is a bit different. The amount of pain killing element inside that is less, but those can be warm or cool, etc. And because depending on what sort of situation you're in, the pain relief may need to be taken regularly, especially for the initial part when the pain is quite significant. You might need to take it like every 3 times a day or so for the first couple of days. Then when it gets better, you can take it as and when necessary, rather than all the time. So Gabby, do I have time to talk, or should I stop? I'm just looking at the clock and realizing it's 5 o'clock.
Well, I think we can stretch all the way to 5:30 with Q&A. So if you, if you have got a couple more slides, you can think everyone will benefit. I think, yeah, please go ahead.
Okay.
Yeah.
Okay, this is really my last part. But it was just a questions that we get. So it's like a lot of people say, do I need to take vitamins, supplements? What do I take to help myself? And really, my answer usually is, if you're having a balanced diet, you don't need to take supplements and vitamins unless you are deficient in the vitamin. There is no magic pill. A lot of the things that we need for self-management is really hard work, like exercising and stretching, etc. You can't build muscle by taking a pill rather than by actually doing the exercise. So, like I said, it really depends. Most causes do not respond to supplements. There are very, very few that are helpful. And if you have an immune type of arthritis, then all the more it will not respond to supplements. So the supplements that may be useful are vitamin D, like I said, if you're deficient, vitamin D is actually it doesn't have a lot of harmful effects, even if you are if you have extra doses. So it could be something that you would supplement. It doesn't just help in your bones and joints, it helps in your immune system as well. Another one is omega-3, where it does seem to help to reduce pain and also helps with inflammation in your body, but you do need to take an appropriate dose. So for most of the doses, it would be at least about 3 tablets a day. So you can't say, if I take one, that you may not get the effect if you're taking a much lower dose. And the last thing, which is also a very popular question, is, does glucosamine work? So the studies show that it helps with people. In some patients, it helps with their pain. So I do have patients who take glucosamine and say that then their knee pain gets a lot better and it's so much easier for them to do their day-to-day stuff. But it doesn't slow down the wear and tear per se. So if you're taking glucosamine and it's not helping your pain, right, then it's not useful, and I wouldn't continue the glucosamine in that case. It doesn't have very good evidence. And so for people who unfortunately fall into the category of immune arthritis, can they be cured? Or even gout? No, these are chronic conditions, and so they cannot be cured, but they can be very well controlled with the appropriate treatment. So in conclusion, most of our aches and pains can actually be self-managed, but it may not be something that can be changed overnight. Lifestyle changes are important. We do need to put in a little bit of work for our bodies. And when in doubt, or if you have any of the symptoms that I highlighted as sort of warning signs, then please do consult your doctor early.